Hemorrhoids are an extremely common condition, affecting half of the world's population after the age of 50. They consist of swollen and inflamed veins inside or around the anus. These swollen or dilated veins can be internal, located inside the rectum, or external, situated under the skin around the anus. The risk of developing hemorrhoids dramatically increases with age. Bleeding during bowel movements is the most common symptom of hemorrhoids. People often notice a small amount of bright red blood on their toilet paper or in the toilet bowl. This bleeding is a sign of internal hemorrhoids and usually the first indication of the condition. For external hemorrhoids, bleeding is less common but can occur. The second most common symptom is itching and discomfort, which can occur with both external and internal hemorrhoids. Itching is usually due to mucus discharge or the hemorrhoid itself protruding, indicating a prolapse, or when hemorrhoids push out of the anus. This discomfort can range from mild to painful. Pain is the third most common sign and worsens during bowel movement straining, sitting for prolonged periods, or wiping after using the toilet. Pain is primarily associated with external hemorrhoids, especially when a blood clot forms. For internal hemorrhoids, pain is less common, but a sense of fullness and discomfort in the anal region can occur. Swelling around the anus is the fourth most common sign, typically defining external hemorrhoids or internal prolapsed hemorrhoids. Internal hemorrhoids are not visible unless they are prolapsed. This swelling is a sensitive and soft lump around the anus that usually reduces in size over time. If it is a prolapsed internal hemorrhoid, manual reduction, or gently pushing it back inside the anus, is possible. The fifth most common sign is a lump near the anus, which can be painful, especially if thrombosed. Patients describe it as a sudden painful swelling. The pain may peak within 72 hours and then gradually subsides as the clot dissolves. This symptom is specific to external hemorrhoids. Hemorrhoids are usually caused by constipation, straining during bowel movements, chronic diarrhea, obesity, pregnancy, aging, and heavy lifting. Anything that can increase intra-abdominal pressure can increase the risk of hemorrhoids. Differential diagnosis should rule out conditions such as colorectal cancer, anal fissures, inflammatory bowel disease, and skin tags, as they can cause similar symptoms. Treatment for hemorrhoids is comprehensive, starting with a high-fiber diet aiming for 35 grams of fiber daily from fruits, vegetables, and whole grains. This softens the stool and prevents straining. Soaking the anal area in warm water for 15 minutes also helps reduce discomfort. Avoiding straining, engaging in regular exercise, and using hydrocortisone cream for temporary inflammation reduction are important steps. Lidocaine cream provides a numbing effect for pain relief, while witch hazel ointments, pads, or liquids can shrink the swollen parts of the hemorrhoids due to their astringent properties. Most cases of hemorrhoids are managed without surgery, which is reserved for severe cases. Fiber supplements, especially psyllium, are very helpful for treating constipation and softening the stool. Oral supplements such as diasmin, hesperidin, and rutin have shown effectiveness in strengthening and stabilizing capillary walls and improving venous tone. Diasmin and hesperidin are often taken together, and rutin is consumed with meals to increase absorption. Surgical methods include rubber band ligation for prolapsed internal hemorrhoids, sclerotherapy for small to medium-sized internal hemorrhoids, and hemorrhoidectomy for large hemorrhoids. Most external hemorrhoids are managed conservatively, with surgery considered only if they are thrombosed and cause significant pain, and conservative measures have failed.